Hi and welcome back to the channel. So here is the latest report from me, having just seen the oncologist after finishing cycle number 3. Okay, so let's start off with my experience during cycle number 3. Hand-foot syndrome was about the same, maybe a little bit more on the feet, but not terrible. This was more so in the first week, and the second week it just tailed off to next to nothing. And it seems to do that with me. So it's normally the first week I sort of don't look forward to, but after that, not so bad. Nothing much else until the second week of chemotherapy meds. I load capecitabine. When for 3 days in a row, during the afternoon, that's before I had my afternoon set of meds and meal, I got some severe nausea. And I mean, pretty bad. I had to sort of take a anti-nausea pill, which I don't normally do. Laid down, actually reclined in my recliner chair, but it's just being me. And my best friend became a bucket because I really did feel like I was going to vomit. Fortunately enough, I didn't. Also, fortunately enough, only lasted for 3 days. I don't particularly do well with nausea feeling, and yeah, this was pretty awful to be frankly honest, but again, I stayed with my side effects. I feel I'm being pretty lucky. Now, my mental state, the old noggin here, has been better, but I've been trying to keep myself more busy. Now, I'm trying to extend my normal YouTube channel, and this means I'm doing more research, which means I'm doing less thinking about the old cancer. I'm also doing more jigsaw puzzles, real ones this time, not just on an app. So, the appointment at the hospital was on the 14th of January, which was the last day of the off medicine. Now, I actually had 2 appointments. I had the oncologist first, and then my general checkup doctor afterwards. And it's the first time he's seen me since I went into hospital. So there we go. I've got to be honest and say that I thought going to see the general doctor was a bit pointless. But I've been known to be wrong before, and I'm sure I will be again. It's not often that you'll hear me admit it. That's the only difference. The oncology visit went well. The doctor was happy with all my blood levels and kidney function, and even mentioned that my electrolyte level was pretty good. This could be due to the fact that I had very little in the way of diarrhea this time round. Yeah, sorry, I know nobody really likes to hear about people's poop, but it is an important part. When you're on IV and oral chemo meds, you do get it as one of the side effects quite often. Anyway, so the doctor was happy, and at the time of filming this, I'm just starting my second day of cycle 4. Now, this is making me nice and happy due to the fact at the end of this cycle, I will be halfway through my 8-cycle system. So I'm pretty happy about that. I get to see my oncologist again on the 4th of February. Hopefully the day after, I will be starting cycle 5. Yeah. Sounds stupid that I'm looking forward to the chemotherapy. I am and I'm not. I just want it over with. So that's why. So if it seems a bit strange that that's the way I'm feeling, it's just because I want it done with. Frankly, if I could do it, I would just take the meds every day. Wouldn't have an off week at all, but don't know how my body would actually cope with that. But still, doctors know best, so I follow them. Okay, so after that, I went to see my normal doctor, general practitioner. You have to understand here in Thailand that unless you go to a private clinic, all doctors work out of hospitals. There is no sort of doctor surgery like you would find in the UK. That doesn't happen. Anyway, I've got to say I was pretty pleasantly surprised when I saw him. Not only was he fully appraised and up to speed on my situation, he was very understanding about everything. Naturally, he did the standard doctor thing. How are you feeling today? To which I laughed and smiled and said, well, with everything that's gone on in the last 4 months since I saw you, yeah. He said, yeah, it's fully understandable. But there we are. He went through my health situation. Now there's a couple of things that could do with tweaking, but he understands that because of the chemo and the fact that I'm having to eat to make the chemo meds not cause nausea in the morning and things like that, that some things can't be changed just yet. So the situation is he realizes that we need to deal with that, but not until the chemotherapy has finished. Another thing, he was quite interested in my mental state, whether I was suffering with depression or anything like that, which I quite like that he was concerned in that respect, because he understands that going through the surgery and the cancer and the chemotherapy, it's very easy to get down and depressed about things, and he just wanted to make sure that I was doing okay. So quite like the fact that he was looking after me 100%, and I appreciate it. In general, he said I'm doing okay, so nothing serious in any way, shape, or form. So that's a good thing. I did explain to him on the mental side of things that I was trying to keep my mind occupied and off the cancer, and he said that's a good thing if you can do it, but he understands that it's not often. Anyway, as I said, I feel lucky in regard to my side effects or lack of them. I think the worst, apart from my feet, I think the worst thing is my fatigue. And I can be absolutely fine and dandy like I am now 1 minute, and then 10 minutes later I can just feel like I want to sleep for a month. I don't, but there we go. So let's look at it. The next video will be in about 3 weeks, just after the 4th of February. That is, unless anything major happens in due course, and God forbid, I really hope it doesn't. Then I can give you a roundup of what's happened during cycle 4, and equally what the doctor says about my bloods and going on to cycle 5. Anyway, until then, take care and look after yourself.